Achol fetches water from a nearby well. For a very long time, they have been taking from that well without encountering any problems. Salam alaikum, Badinho. I have a story for you. So our sister Achol is from South Sudan. Achol lives with her grandfather, grandmother, uncles, aunties, father and 3 wives, cousins, and then her siblings.
What the hell?
That well is like 500 meters away from those of Acholi's home in Toin. Her and her siblings carry water in jerrycans from the well to home. Every time when they fetch water, they boil it before drinking. At least that is what they made sure of every day when their mother is around. Until Achol maakuwa natondwa tanindel shurbu moya makalo. They drank unboiled water. And guess what happened? 2 days later, she was hit with sudden diarrhea, watery diarrhea, leg cramps, and extreme thirst. Extreme thirst as in she could take water and then she could not become quenched. What is happening? Achol decided to take herself and her siblings to the nearest hospital, where they were diagnosed with cholera. Cholera. It is a disease that is caused by Vibrio cholerae, a bacterium that is found in water.
God help me now that day.
The doctor at the hospital gave Achol and her siblings oral rehydration solution so that they can replace the water that they lost in the watery diarrhea. And they were also given antibiotics so that they can prevent an outbreak of cholera in Toin. And they were also given IV for the younger siblings because they had lost the most fluids. As of March 1st, 2025, 34,688 cases of cholera were reported. Achol and her siblings were among. They were counted. 583 deaths were reported. Thank God, Achol and her siblings didn't die. That is just in 39 counties. And remember, South Sudan has more than 39 counties. I'll let you do your research on that one. So, please wash your hands after using the latrine and do not dispose your property everywhere. When I say property, I mean feces.
Okay.
Boil your water first before taking it and wash your hands after using the latrine. The vaccination coverage of cholera was quite impressive.
We are extremely happy.
As of January 2025, 90% vaccination coverage of cholera in Juba, Reng, Malakal, and Rukona, only in 4 counties. And as of February 2025, 15 counties were covered and guaranteed a 93% coverage. That's nice. That's very impressive. So if you're in those states or those counties, please go for vaccination. And if you are at risk of getting cholera, please go for vaccination. And I hope my content reaches those counties as well. Follow South Sudan Institute of Public Health Research to know more about public health.